Do you ever get the feeling that doctors and surgeons don't really give you the full picture when you're talking to them about joint pain, back pain, hip pain, shoulder pain, or whatever? You ever get the feeling that maybe the incentive structures are a little bit skewed so they may not give you the full information that you want and need? Well, I'm here to tell you that it goes a lot deeper. The rot is a lot more pervasive than just in that person who's standing there in front of you. Because even if that person in front of you is trying to act in your best interest, the actual evidence base that they're working from, the research literature that they're referencing, is often so broken, corrupt, and deceptive that they can't even help you, even if they really want to. So in this video, I'm going to show you exactly how some of these deceptions happen, how data gets manipulated to paint a very rosy picture for treatments that really don't seem to make much sense and certainly don't seem to perform any better than a placebo. So in this video, we're going to see a very clear example of how this fraud is perpetrated over years and convinces people to get a surgery that actually turns out not to be as effective as surgeons want you to think it is. So if you watch this video to the end, you will understand exactly how science is being twisted and skewed to trick you, and it'll help you protect yourself in the future. So if you're ready, let's get ready to think right, move right, and feel right. Before we go further, this is my friend Boney, and he's going to be helping me throughout this video.
Hi there, nice to meet you.
Today we're talking about hip impingement surgery, which is when doctors go in and shave down bones and reshape things in your hip joint because they say your bone shapes are bad. They have grown incorrectly, they're maybe a couple millimeters too long here, or maybe the bone right here is a little bit too big, and then supposedly those bones run into each other prematurely, causing premature breakdown of the hip joint and hip pain. Now, this surgery was only made really popular and started spreading pretty much like wildfire in the early 2000s after a surgeon in Europe started teaching other surgeons how to do this surgery after he and his team had been doing it for several years in Switzerland. Now, this surgery was based on the idea that the cause of hip pain and arthritis was these bad bone shapes. This doctor perfected a way of opening up the hip, shaving down these bones, and claimed that this fixed everybody's problems. And over time, everyone started saying, yeah, this makes sense. This is great. This sounds plausible. It's a highly effective surgery. But a lot of research has come out that shows that it's really not that good. But you won't find that story in any normal source because the research, the evidence that they use, and the abstracts, the summaries in the research are really skewed and are sometimes just outright deceptive. We're gonna look at how this surgery actually stacks up. We're gonna see the actual effectiveness, meaning how satisfied are patients when they get this surgery, and we're gonna see how those numbers have stayed kind of consistent, even though the surgeons who have been promoting this surgery are doing their best to hide the actual numbers. Hey, I wanna interrupt for 1 second and ask you to hit the like and the subscribe button if you're not subscribed already. During this 2024 holiday season, I'm going to be donating 1 cent to the Wounded Warrior Project for every like, every single like, and every new subscriber we gain on this channel from now to the end of 2024. So please hit that like button. I'm going to give 1 cent to the Wounded Warrior Project for every single like. I want to give at least $5,000 to them this year. So please help me out, help them out. And now let's get back to the video.
How would they hide the numbers?
That's a great question. And to really understand that, you're going to need to look at an example of one study in 2022 that says this: FAI surgery provides lasting improvement in function and a joint preservation rate of 90.4% at 10 years. That sounds great, right? If you see that number, 90.4%, you're thinking, okay, that's really great. Provides lasting improvement in function, that also sounds great. You see those things together, you think, yeah, okay, awesome. No wonder when I ask the doctor whether or not the surgery is effective, they're gonna tell me, yeah, it's 90% effective. Maybe if you have a more conservative surgeon or doctor, they might tell you 80% because they saw some other paper that had that number, but 90.4% Sounds great. Now, we need to dig deeper. We're going to come back to this study so you understand the truth here and understand exactly how this deception is being perpetrated. So now let's rewind and look at this paper from 2012 and look at a number that doesn't get mentioned at all in the summary. So when we look closely, you're actually going to see something really weird. Boney, do you want to read the conclusion in the summary for me?
Conclusion: expectations of surgery were overly optimistic. Having one's expectations fulfilled, especially in relation to pain, was important for a good outcome.
Now, they didn't give you any numbers here, but they at least hinted at a big problem. They said that patients were overly optimistic when they went into surgery. Okay, well, what does that mean? Well, they actually have a chart here that looked at whether or not a patient had their expectations met from the surgery, and they had different metrics. So they looked at hip pain, they looked at walking capacity, independence, sport, general function, social function, and mental well-being, and they said, well, after the surgery, do you feel like the surgery gave you what you were expecting? Did the surgery effectively do what you thought it was going to do? And this dark bar here in all these different categories represents the percentage of patients who did not have their expectations met. So in terms of hip pain, 56% did not have their expectations met. In terms of sport, 61% did not have their expectations met. And in terms of general function, 53% did not have their expectations met. Okay, well, that was in 2012. That was only about 10 years after the surgery had been widely practiced and propagated across the globe. So maybe things got better, right? Because, you know, this is supposed to be an incredibly great surgery that this 2022 paper claims is, you know, 90% good, right? So this 2012 paper that shows that more than half of the patients who underwent the surgery were disappointed must be a fluke, right? So let's look at another paper that talks about how we measure success with hip impingement surgery.
Are there different ways to measure success?
That's actually a fantastic question because surgeons have many ways of measuring success, but there's really only one way, in my opinion, that really makes the most sense. So let's look at this paper from 2015, the patient acceptable symptomatic state for the modified Harris hip score and hip outcome score among patients undergoing surgery for FAI or hip impingement. Now this paper is really interesting, and if you're seeing my chicken scratch here and you can actually read this, then good for you. And yes, this is foreshadowing for what's to come because this paper does some really intellectually dishonest and tricky things. But before we get there, we'll talk about how you measure success. So you can measure success by saying, hey, surgeon, was this successful? And the surgeon is going to have some criteria for what success could be. Like, did we repair the broken tissue? Did we make sure there wasn't too much bleeding? Did the patient not have an infection that threatened their life? Did the patient close up? Did everything heal properly? So those are certain metrics you could use. Did the patient not die? That's another great metric you could use, but those metrics don't really measure success from the patient's point of view. So you could use another metric that's something like the questionnaires they use, like the hip outcome score or the modified Harris hip score, which are these questionnaires that surgeons have devised where they say like, hey, how do you feel when you're walking for 10 minutes? How does it feel to get up and down from a chair? How does it feel if you have to walk more than 5 blocks? How does it feel when you need to sit? How does it feel when you need to do whatever? So they have all these different questionnaires, different questions in each questionnaire. Some of them make more sense than others. I've talked about that in other videos. But the long and the short of it is you can have these types of questions and score them and come up with a total score for a patient after the surgery. And then you can say, well, that score shows you improved. And as long as you improved by enough points, we're going to consider it a success. Now, that concept is abbreviated as MCID, or minimum clinically important difference. And they use that a lot in these hip impingement surgery studies. They like to use things like the modified Harris hip score, the hip outcome score, and IHOT 33 is another one. And they like to look at those scores and say, well, if the patient gets at least 6 points or 5 or 10 points or 8.3 points, then that counts as an improvement, that counts as a success, and we're just going to mark it as a success. So this study introduces something called the patient acceptable symptomatic state, which is another way to measure it, which is way better. So the patient acceptable symptomatic state is basically saying, hey, do you think that your symptoms now after surgery are good? Are you satisfied?
That seems pretty straightforward.
Yeah, and in this paper, they actually have a great quote that explains this PASS or PASS. The PASS defines a level of symptoms that discriminates between feeling well and unwell. Unlike the minimum clinically important difference, the PASS is an absolute value, not a change. The minimum clinically important difference deals with the concept of improvement or feeling better, while the PASS deals with the concept of well-being or feeling good. Compared with the MCID, the PASS has the advantage because it represents a threshold beyond which patients report feeling well for a given score on a patient-reported outcome measure. It represents a tangible and clinically relevant treatment target and can provide critical information to researchers for the design and analysis of randomized controlled trials. It's really simple. Are you satisfied? Look at all your symptoms right now after surgery. Are you satisfied? Yes or no? If you say yes, whew, yeah, awesome, sweet. If you say no, well, that's a failure. Straight out, simple, easy.
So what does this have to do with the scores?
In this study, they wanted to see what scores with the modified Harris hip score and the hip outcome score correlated to patients saying they were satisfied or hitting that pass. So what they did was they got 130 patients and they said, okay, we're gonna give you surgery, you're gonna do all these questionnaires, and we're gonna see who gets pass and what their scores are on the modified Harris hip score and the hip outcome score. And then from that, we're gonna see what scores correlate to actually being satisfied. So if you think about this, it makes some kind of sense because a lot of other studies have used the scores of improvement to kind of base their success levels, right? They'll say like, well, these patients improved by 7 points, so yeah, that went great, everyone should be happy. But this study is saying, well, would those scores actually mean the patient is happy? What are the numbers that would correlate to actually being satisfied? So they did some fancy statistical analysis and they said, okay, well, based on our analysis, at 1 year after surgery, the PASS scores are 74 on the modified Harris hip score and 87 on the hip outcome score for activities of daily living and 75 on the sports questionnaire. So now it's real simple. If you hit these scores on the questionnaires, they believe that means that you would also achieve pass.
Well, that's cool.
It is kind of cool because again, you could take these numbers, assuming they're correct, and apply them to other studies that have been done that use these scores, and you could try to figure out whether or not those patients were satisfied.
Couldn't you have just asked those patients?
Yeah, you really could have and should have asked patients whether or not they're satisfied and reported on that in previous papers, but for some reason, surgeons didn't really do that.
Why wouldn't they do that?
You know, that's a really good question because if you just straight up asked the patients whether they were satisfied, you'd have a really clear-cut answer, just like they mentioned in this paper. If you just ask people, are your symptoms now acceptable? Are you in an acceptable state for daily life or for sport? You get a yes-no answer and it's a really clear answer, but surgeons didn't ask that question for many, many years. Now in this 2021 Danish study, they found that fewer than half, 46.7%, were satisfied with the surgery, meaning only 46.7% said, yes, I'm satisfied, my symptom state is acceptable. So that pass, well, less than 50% hit that pass mark. In this study, they note that some previous studies done before 2021 actually looked at different outcome scores and also pass. But they said something really interesting here. They said, surprisingly, none of the above studies reported the proportion of patients that achieved pass based on the question itself, despite having obtained this information for calculation of the cutoff score. Now, what does that mean, right? So they're saying here, we argue that the present study is the first to clearly report pass in a general population after hip arthroscopy for FAIs. So basically they're saying, hey, all these other studies that people did and published, They said they measured pass. They said they also measured the other outcome scores, but they didn't tell us in their papers how many patients actually achieved pass. How many patients were satisfied?
Wait, why wouldn't you do that?
Yeah, it is really strange that these scientific researchers would conceal the number of people who actually were satisfied in their studies. And when we go back to this 2015 study that we talked about earlier, when you look at my chicken scratch here, it says high number of real pass. And that's because they actually say that they calculated the numbers on the HIP outcome scores. They calculated the numbers that correlate to patients achieving pass. But when you look at their data tables and when you look through the entire paper, you discover that they never tell you how many patients actually achieve pass. Now think about the incentive structure here. If they did the surgery and they had a high percentage of people who achieved pass, who were satisfied with the surgery, they would have every incentive to tell you that number. If that's a high number, it also means that the calculations are probably a little more reliable. Because if you say we had 130 patients and only 2 of them achieved pass, then your numbers, your outcome scores that supposedly correlate to pass, they're not very reliable. You only had 2 people, right? If you had 50 patients achieve pass, it would be maybe a little more of a reliable number, but you'd have to start wondering why was the actual total number so low? If you had like 100, maybe then that'd be better. Then you could say, well, we had 100 people achieve pass. Here were their scores. All of them scored above 80. Like it starts building a better case. But if you have a low number, then these cutoff scores don't even make sense. They probably are not valid. And also, it means your surgery didn't actually perform well and it didn't give people the results they wanted. And here in this paper, they went out of their way to not disclose the number of patients who achieved pass, which should make you wonder what the heck is going on.
It seems like they were,
I'm not sure exactly what to call it, but if you've got a good word for what they did in this study, drop it in the comments section down below.
it seems dishonest.
You said it, not me, so let's just move on to the next paper, which is 10-year outcome following surgical treatment of femoral acetabular impingement. And this one was published in 2022. This whole paper is based on one surgeon doing surgery over 10 years. Now you might be saying, well, it's a single surgeon study, so is it really applicable to everybody else? And I would just say, well, if you are a patient looking for a surgeon to fix your hip pain, you're looking for one person who's pretty confident, who thinks that they're doing a good job with their surgery, who has a lot of experience. Somebody who volunteers to look at their surgical results is pretty confident in their surgical results. You don't get the least experienced hip surgeons in the world saying, yes, I want to publish a paper that looks at my results. If they're not confident, they're not going to want to do anything like this. They're going to only want to do something like this if they're pretty confident their results are pretty darn good. So when they publish their conclusion that, you know, there's a lasting improvement in function and joint preservation rate of 90.4% at 10 years, it sounds fantastic. But guess what? They looked at some stuff and they didn't talk about it very much. And what they didn't talk about very much was the pass score. What they did talk about is some of the scores actually did improve. So if you look at the WOMAC, which is another questionnaire, you see they went 60 to 75, 15-point change or whatever. Yeah, that's awesome. You look at the HIP outcome score, 65 to 78. Hooray, that's so awesome. Let's see, HIP outcome score for the sport subscale, you see 43 to 63, 20 points. Yes, that is so awesome. And then you see the pass percentage, and then you get to 47%.
Did you just say 47%?
Yeah, I said 47%, less than half. Well, what about for the sports subscale? So for people who want to play sports, recreation, all that stuff, they must be...
What's it say? What's it say?
Yeah, it says 46%.
Less than half?
Less than half. And what's even funnier is they actually have this pass percentage. It's a calculation based on the cutoff scores from that other study we were just looking at. So They didn't even ask patients whether or not they are satisfied. They just calculated this pass percentage based on the scores.
Wait, why didn't they just ask?
If we're being charitable, at the time that hip surgery started for hip impingement, surgeons for some reason just weren't generally asking patients whether they were satisfied. They were just using these objective scores to see whether or not there was some improvement.
Yeah, but it's such a simple question.
Well, the thing is, surgery is a very complex topic, and you don't really want to overly simplify the results by just asking patients whether they're satisfied.
That seems dishonest.
I don't know if honest is quite the right word, but maybe scared to know the real results. And so this study concludes the main finding of this study is that the 10-year hip preservation rate following surgical treatment for FAI was 90.4%. This is a very promising finding, emphasizing the value of FAI procedures and is in line with other studies that have primarily focused on reporting outcome of FAI treatment using a single technique. So again, this surgeon and his cohorts looked at all the data and they said, woo, the most important thing here is that 90% did not have to get their hips replaced within 10 years of our doing this surgery that left more than half of them dissatisfied. So to recap, there were already studies showing up more than 10 years ago that showed that patients were dissatisfied with the results of hip impingement surgery, and not just a few, more than half were dissatisfied in terms of relief of hip pain, return to sport, and general function. But surgeons continued to use outcome measures like the IHOT-33, the Modified Harris Hip Score, the Hip Outcome Score, the WOMAC, the UCLA, blah, 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 and they started trying to find ways to bury the actual satisfaction rates. One such study tried to come up with cutoff numbers that showed that if you scored like an 87 on this questionnaire and a 75 on this questionnaire, you probably passed. But in this paper, they hid the actual number of patients who actually really truly were satisfied with the surgery. And if you look at the incentives involved, you can't help but conclude it's because they were embarrassed by the actual number of patients who actually passed. Because if that number had been high, they would have put it in here. But if that number is a little bit low, you have every reason to hide it because it calls into the question the whole surgery as well as the validity of your scoring system. So this paper easily wins my award for the most intellectually dishonest piece of garbage out there. Then you can see in other studies in 2021, when they actually asked patients, are you satisfied? Is your symptom state good? Fewer than half, 46.7%, said no. No. So again, the majority of patients who undergo hip impingement surgery are dissatisfied. And in this final 2022 paper where they highlight the 90.4% at 10 years don't need to have hips replaced and have lasting improvement, they're actually hiding the fact that they used a bogus calculation cutoff number for pass, and even with that bogus number, fewer than half of the patients in their study were satisfied based on these weird bogus numbers. So there you have it. When you actually ask patients whether or not they're satisfied with hip impingement surgery, more than half say no.
This is kind of depressing.
I think the most depressing part is just how intellectually dishonest this research is. When you can already see over 10 years ago that there were problems with this surgery, surgeons, researchers, everybody should have been asking better questions. Rather than trying to hide the poor satisfaction numbers, they should have been looking into whether or not the surgery made any sense. When you have fewer than half of the patients being satisfied, you have to wonder how much of this is due to the placebo effect, which is a well-known powerful effect, especially for orthopedic surgeries. There is a long history of orthopedic surgeries being completely without base, without scientific evidence, and in the long run, they show that they are no better than placebos.
I could go for a placebo right now.
The big takeaway here is that if you are talking to a doctor or surgeon who is just reading the summaries of these papers, they're going to have a very skewed view of the actual effectiveness of this surgery, and they're going to think, with good intentions that you'll be happier getting a hip surgery. When they see stuff like 90.4%, and they're just reading through it really quickly, they're gonna think, well, yeah, of course I'm gonna tell my patient this is good for them. But if you even just flip a few pages in and start looking at the data, you're gonna realize, maybe this is not such a good idea. The problem is most doctors don't have the time to be doing that. They just look at summaries, and surgeons, if they have the time, and they probably don't because they're also busy, they have years and years and years invested in what they do. They do it because they believe they're helping people, and they are not gonna want to actually look at these satisfaction numbers seriously and will simply dismiss them and say, well, that's probably just because the surgeons involved in the studies were not very good. I strongly encourage anybody with hip pain, whether they have the hip impingement diagnosis or not, to look at different exercises, stretches, massage techniques to free up the muscles that surround your hip joint. The hip joint is surrounded by many, many muscles, 21 roughly if you don't want to count all the other stuff. But there are a bunch of muscles that wrap around the hip joint itself, and those affect how you move it. Those affect whether bones collide. Those affect how comfortable you feel in different ranges of motion. The physical therapy protocols that you find at your hospital or at your physical therapy clinic are usually worse than useless. And I've done videos on that, talking about that I'll link to down below. You need to do more research, you need to explore, and you need to experiment with your own body to free yourself from hip pain. So I encourage you to do that. I encourage you to watch my free videos. If you want to try my full program, the Healthy Hips program, I invite you to check that out at uprighthealth.com/DIY. If you have the hip impingement diagnosis, look at the details at uprighthealth.com/FAI. You'll find links down in the description box as well. And if you don't trust me, you don't want to give me any money, that's totally fine. Find a coach, find somebody, find a physical therapist, find somebody who is willing to help you relearn how to use your body and relearn how to use your hips properly. The cookie cutter stuff out there is garbage. You gotta find stuff that will be tailored to you, that you can customize to your specific hips needs.
Your specific hips needs?
Okay, I messed up when I said that, but your hips need more specificity. You need to actually give them what they need, not just some stupid cookie cutter template. I also encourage you to check out the links in the description box that go through all the research so that you understand what you're looking at and what I'm talking about. There are tons of research articles that look at the FAI hip impingement tests, that look at imaging, that look at arthritis, that look at labral tears, all of these things. There's tons of research on them. You don't need to be as scared as the doctor says you need to be. Go read through those links. They'll be in the description box. I hope they help you. I hope they help you stay more calm and they help you rebuild your hips. Remember to hit the like button if you want to support me and the Wounded Warrior. Subscribe if you haven't already. And as always, I hope you remember that pain sucks, life shouldn't.